Hello, I'm Patricia Couture, registered nurse, and welcome to Transformational Leadership, Reducing Stress in Nursing. I hope you enjoy this presentation. This video will discuss what transformational leadership is, what causes nurses workplace stress, and how transformational leadership can play a key role in creating magnet workplaces that successfully reduce stress for nurses. Transformational leadership can positively impact healthcare teams and the patients and families nurses provide care to. Stress. It can make your heart pound, your breathing quicken, and your forehead sweat. Nursing research indicates there are multiple factors contributing to workplace stress and nurse fatigue. Workload, interpersonal relationships, ethical issues associated with patient care, relentless change, absence of acknowledgement for nursing expertise and skills, practice limitations due to political and resource constraints, high patient acuity, increased expectations from patients and their families, disorganization within the workplaces, and sensory overload. When nurses develop and display transformational leadership qualities, there is a decrease in nurse-reported stress levels and an increased capacity for nurses to cope. Workplace stress can be viewed as any distressful experience for an individual within their work environment. It is multidimensional, consisting of physiological and psychological effects. Prolonged stress occurring within an environment with no intervention can lead to burnout and causes nurses to leave the profession. Stress is reported as the #1 reason for absenteeism among care professionals. Lack of teamwork and support from colleagues is seen to be critical for nurses suffering from burnout. Leadership skill deficits among nurses significantly contributes to stress within our workplaces. Transformational leadership is a relatively new term that has really occurred within nursing since Florence Nightingale had the vision of caring for patients and leading her teams. Transformational leaders successfully create and disseminate a vision that provides clear direction for all followers. They look for new paths that help bridge transitions forward towards future ideals and outcomes. They are systems thinkers. These leaders uphold the values of an organization, have sound moral perspectives, and utilize nursing ethics. Their service ultimately contributes to the greater good of society. These nurse leaders are change agents within our workplaces. They use, introduce, and encourage innovation. They use effective communication and collaborate within intersectoral teams. Their well-developed skills and abilities contribute to their credible nursing knowledge. This is exhibited in the foundation and formation of trusting relationships. Transformational leaders review, evaluate, and use qualitative data to seek improvements while displaying and celebrating the successful results. Creating a vision. Creating a vision leads us down the path to successful interventions. Vision statements use concise wording to create big picture images. Whether you are designing or redesigning, creating a lasting map for yourself and others to follow is a key priority for transformational leadership. Creating a vision is the first step and is instrumental in achieving the best possible results. Create your vision today. What would your vision look like? One of the first steps to transformational leadership is to believe in yourself. People with high self-esteem tend to cope better with stress and recover quicker from adverse events. Self-belief can change throughout our life as a result of our experiences. So be kind to yourself and regularly celebrate your accomplishments. Lynn is viewed by her colleagues as a transformational nurse leader. She inspires the team and creates better patient outcomes. She is an SRNA workplace rep, facilitates the junior volunteer program, and has been a preceptor for multiple nursing students. It is truly a beautiful thing when a career and a passion come together. Interactional feedback describes the acknowledgement and communication between colleagues in the workplace. Individuals experiencing interpersonal communication can be empowered to do better, be better, and contribute more. Failing to provide positive feedback results in high stress, high turnover, and burnout. Mentorship is a key component towards transformational leadership. Nurses who experience a greater level of autonomy, work empowerment, and accessibility to resources in conjunction with the presence of strong leadership at the work will more likely be satisfied within their current position. Creating strong social networks helps nurses facilitate change. The absence of positive or other forms of constructive feedback from senior nurses in the nursing profession contributes to stress at the workplace. A lack of support from colleagues is seen to be critical for nurses suffering from burnout. Celebrating successes and creating dynamic teams contributes to positive work environments. Recognizing achievements is a vital component of transformational leadership development. This week I had a wonderful opportunity to meet with a patient at the Regional Health Centre in Prince Albert. Jan, Minnie and her family discussed their journey through the health system over the past several weeks during an interview. Jan has COPD, and a severe infection led to several emergency visits and then resulted in her being intubated for 10 days while in ICU. Jan contributes her successful recovery to the positive quality seen in transformational nursing leadership. She had experienced, knowledgeable staff, collaborative teams, direct, honest communication, and a welcoming family presence. These attributes were highly valued during this critical time in their lives. The following sound clip is part of that interview.
But the ones that impressed me the most were the ones that explained what they were doing when they were doing it.
Everybody did.
And they almost did.
Everybody did.
Because as a family member, we got this book that we started, and we wrote everything down that was happening with Jan. Because we don't understand it, we have to write things down. So the nurses that came in, they would explain to Jan, but also in that process was basically explaining to us what was going on and what was happening.
Right, because they let you stay, from what I understood from your conversation with me, 24/7 at her bedside, right?
Yeah.
So that was 100% important to me.
Okay.
And still is. I needed that support. And still is.
Right.
There is an escalating need for highly educated and proficient nurses to improve patient outcomes. Communication and positive relationships, which show respect to others' knowing, makes nurses more efficient and effective in their roles and helps in developing trust. Nelsie and Brownie in their 2012 article discuss the value of effective partnerships, citing teamwork increases performance, improves productivity, reduces tension, and increases nursing satisfaction in their professional roles. Barnetto et al. In their 2013 article linked the association between transformational leaders and their followers. Transformational leaders can positively affect performance, influence commitment, and contribute to effective teamwork, decreasing turnover rates for nurses. Embracing change. Evidence indicates that prolonged work hours, rotating shifts, and insufficient breaks slows reaction time, decreases attention to detail, promotes errors, compromises problem-solving abilities, and reduces motivation for nurses. Patients' risks increase when care providers are tired, overworked, and unhappy. Embracing change and working through technological advancements are providing a bridge towards better patient outcomes. Opportunities for ongoing education through technological advancements such as telehealth can facilitate the development of nursing students and rural nurses in or close to their home communities. This has shown to increase rural nursing recruitment and retention rates and decrease stress for learners. Transformational leaders inspire those around them. They promote the creation of positive work environments by role modeling, mentoring, and providing support to their colleagues. They take risks for the betterment of their patients and society, not because they have to, but because it's the right thing to do. We have learned that transformational leadership can help reduce stress in our work environment, but in order to evaluate our stress, we must understand it as a dynamic force. Transformational leaders create vision, discover new paths, overcome challenges, embrace opportunities, and share their passion for nursing. Nursing leadership must be present, approachable, and responsive within our work environment. The next time you feel stressed or are considering a job change, reflect on why. Seek solutions for effective change, and I encourage you to develop the transformational leader within yourself. This week, reflect on your transformational leadership action plan and share your vision for nursing in the future. Do you know a transformational leader? Share how this person motivates you and reduces your workplace stress.
you have anything for the references?